Hi, I'm Bobby Jones, President of Delta Medicare Benefits Group. Today in this short video, we're going to talk about Medicare Part A. In this video, we will address what Medicare Part A covers, how much it costs, the deductibles and copays you can expect, and when and how to apply. If this information is useful to you, please give us a like and share with your friends and/or on social media and subscribe for more updates. So first, what does Medicare Part A cover? Medicare Part A is hospital coverage. It includes anything inpatient. Inpatient hospital stays, room and board, any lab tests that you may take while you're in the hospital. It's also going to cover skilled nursing facility, hospice care, and in some cases, home health care. Okay, so how much does Part A cost? Part A is typically free for most of our clients. As long as you have worked and paid into Medicare for 40 quarters or 10 years during your working life, you won't have to pay for Medicare Part A. If, however, you haven't worked for 40 quarters, but you do have 30 quarters, your Part A coverage will cost $274 a month. Now, these are 2022 figures. If you have fewer than 30 quarters, you may pay $499 a month. Remember again that these are the numbers for 2022 and they change yearly, so make sure you like this video and subscribe to our channel for these types of updates. Third, what are the copay and deductibles that you're going to pay for Part A? Well, there's a $1,556 deductible for each Part A benefit period. Now, a benefit period is defined as when you have been out of the hospital for 60 days, a new benefit period begins. Therefore, it is possible to have several Part A deductibles within a year. Let me give you an example. If a person goes into the hospital, say January 1st for a couple of days, and they get out January 3rd, where they're going to have to pay their $1,556 deductible. Say they go back in March 15th, we'll say. So since 60 days have elapsed, now they're going to have to pay that deductible again. Now, this deductible is going to cover the first 60 days in the hospital, and what we're going to talk about is consecutive days. So that deductible is going to cover the first 60 days in the hospital, but after the 60th consecutive day, starting with day 61 through 90, Medicare is going to charge a $389 per day copay. Now, after the 90th consecutive days, days 91 through 150, the copay is going to double to $788 a day. Now, these last 60 days are called lifetime reserve days. You're only given 60 of these over the course of your life. After you've used these reserve days, you're on your own. Let me give you another example. Let's assume the person is in the hospital for 155 straight days. Highly unlikely, but we're going to talk about it anyway. They're going to have to pay their deductible, the $1,556, and that's going to cover, again, the first 60 days like we talked about. Now, days 61 through 90, Medicare is going to carry the $389 a day. That's an $11,670 total exposure. Days 91 through 150, remember, it doubles to $788 for a total exposure of $46,680. Now, days 151, remember we're 155 days, days 151 through 150 are going to be completely the responsibility of the patient. So this same person now, say, goes back into the hospital next year for another extended stay. Everything is going to apply just like it did before. The $1,556 deductible is going to cover the first 60. They're going to be responsible for the $389 for days 61 through 90. But now, if they stay beyond 90, since they've used those lifetime reserve days, they're going to be 100% on your own. And again, it's important to know that we're talking about consecutive days in the hospital. Additionally, copays for a skilled nursing facility, Medicare is going to cover the first 20 days at 100%. But days 21 through 100, there is a $194.50 per day copay for a total exposure of $15,560. Now, be on the lookout for a future video on Medicare supplementation that will help you cover all of these costs. If you subscribe and push the notification button, you will be notified when the new videos are published. Now, let's talk about when and how you can apply. You will apply for Part A during your initial enrollment period. That's the 7-month period that begins the 3 months before the month you turn 65. It includes the month you turn 65, and it will also include the following 3 months. This is the time when you will enroll in your Medicare's Part A and B. If you're choosing to remain on your group coverage at work, I would recommend enrolling in Part A only because in most cases, again, it's free. We'll further discuss enrollment in Medicare Part B in a subsequent video. Let's discuss how you can enroll in Part A. Many times you will get enrolled in Part A automatically if you're on Social Security. If not, you can call Social Security at 800-772-1213, or you can register online at ssa.gov/Medicare, or call the Delta Medicare Benefits Group office and we'll be glad to do it for you. And by the way, there is no charge for this or any other service that we provide to our clients. I hope this video has helped you in your understanding of Medicare Part A. Our phone number is on the screen. It's 901-460-7220. If you need help enrolling or you have questions, please call me again at 901-460-7220. And again, if you found this video helpful, please hit that like button and subscribe to our channel. Thanks so much for listening.